Officials at the Ministry of Health are upbeat about getting the COVID-19 vaccines within the earlier scheduled June period in spite of the prevailing circumstances that may hamper importation of the required doses.
As Uganda, we will have all our vaccines, even those government is going to procured through the COVAX facility because it already has agreements.
Each passing day, India is registering record high numbers of positive cases and deaths. It registered over 260,000 cases in the last 24 hours, bringing the total number to slightly over 25 million and 270,000 deaths according to the World Health Organization. India was the main supplier of the AstraZeneca vaccines to developing countries like Uganda. The World Health Organization country representative Jonas Waldemariam says India's suspension of vaccine exports is understandable.
We would like to see India vaccinate as many people as possible so that they can contain this COVID.
Disruption in the earlier planned schedule for the arrival of the second batch of the vaccines is not envisaged.
The AstraZeneca is not only manufactured in the Serum Institute in India. The other factories outside India. So we're looking at those options.
The COVAX has signed an agreement for delivery of the Johnson & Johnson and Novax, which is another coming up.
The health officials say those requiring the second and final jab will receive it within time, given the widened window within which it can be taken.
Even if we are delaying it after 12 weeks, the immunity which the first dose gives would prevent a significant proportion of severe diseases and almost prevents people from dying.
There is a possibility that the next batch of vaccines may not be AstraZeneca with Johnson & Johnson under consideration.
And combining different vaccines. The data is not yet ready, so what we still recommend is to remain in the same vaccine.
Cases of COVID-19 are once again on the increase in Uganda, with 164 registered on Monday alone. It brings the registered cumulative cases to 40,350 deaths, while the vaccination administered is half the 900,000 doses received in the country.
As of yesterday, there were about 83 active cases admitted in health facilities, but there are also those who are under home-based care who are about 800. So the disease, the COVID-19 is spreading, so we need to be more vigilant.
The public is more than ever before reminded to take seriously the precautions for the prevention of the spread of COVID-19, such as wearing of masks, washing hands, sanitizing, and social distancing. Jackson Onyango, NTV.